Hi, everybody. We are back.
You're back. I saw this article specifically in Barrie, Ontario, and I wanted to bring it up for our listeners and for you to comment on because I thought it
Yeah.
was
Okay.
interesting, but
Uh-huh.
also funny. Okay, so let's just walk it back a little bit. I'll tell you a little bit more before we proceed. So it says David's belly button buddy book deals with childhood anxiety. Now, I
I already
love
hate
that
everything about this title.
I love that it
I
deals
don't
with
like belly button stuff, man. Nope. Nope.
yeah, I find it to be an interesting concept. So essentially it's helping to deal with childhood anxiety, but I'm going to read it a little bit more so you can get some context. A new children's book called David's Belly Button Buddy was written to help children dealing with anxiety in a fun, relatable manner. Growing up can lead to some children feeling anxious. In Canada, upwards of 20% of children and youth can expect to deal with anxiety. And so, I was trying to understand what the premise was and why belly button
I was
lint
gonna
would
say I
help.
already don't understand where the belly button comes into play with the childhood mental illness, but we'll keep going.
So, in the book, David finds comfort in the fluff he discovers in his little belly button.
No,
Okay.
absolutely not.
If you're getting the ick about this, I feel like it should be a universal ick.
Yeah, I just like any hygiene. You know what though? I'm not a derm girl. So like, you know how
Mm.
people ask me all the time, they're like, do you watch like little surgeries or like Dr. Pimple Popper? I'm like,
Oh,
I can't think
no.
of anything grosser. I
Ugh.
cannot. I feel bad. And because I know it's a real thing, but even when I see, the skin of those people that suffer from like cystic acne, like really, really badly, I struggle. I feel so bad for them as people, but like, any type of like rashes, like for people send me their rashes and stuff. I'm like, can you not? Can you not?
You know what? You know,
Oh
I
no.
acne, I feel like I don't look at acne the same way as I'd look at belly button lint.
I know.
But
Oh.
no, I definitely I'm not the person. Now, I guess for me, it's like I can pop pimples of people I know,
Oh my god, I can't
right?
even talk about it. I can't even talk
Oh
about
my
it.
God, you can't pop. I'm
No,
actually shocked by hearing this
no,
information.
this is like the one thing. This is like Ashley's bugaboo. Like I cannot. I
I
cannot.
am
Everything about
completely
that.
shocked by this information. If you had gun to my head, would Ashley pop a pimple? I'd be like, absolutely, she'd be fine with it.
No, no, she goddamn wouldn't. She leaves her skin alone. There's no scar. Like if I have a pimple, we just have to live with it.
Oh my
Maybe I would
God.
throw some cover up on it, but let me tell you, we would not be touching it. We wouldn't.
You know what? You're so much better off not touching your acne because it'll just I pick and then things fester and
Oh,
get
let's not talk about the festering. We can't
okay.
do this.
But I have a weird thing. Maybe some people can relate. Maybe some people think I'm the crazy one in this scenario. Um, so can't deal with porta potties. We all know and love this fact. But
Right.
I pick at my kids. So if I see earwax in their ear, I'll put my finger in
No, 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 no.
or I'll see dry skin, I'll peel it off his ear or something.
Your poor
Yeah.
kids.
Yeah. I'm definitely a picker. A
Yeah.
picker till the end. But I feel I wouldn't be picking belly button lint. I feel like I don't
Nope.
have any, thankfully.
Well, I'm not investigating. So,
Um
um,
okay, but I can understand how this happens. Okay, do you have an innie or an outie?
any.
Okay, me too. I don't know if this is true information, but I think that what determines your innie outie situation is how your umbilical cord is cut when you're born. Is that true?
Ooh, good question. I would presume it would be a factor. But
Yeah.
I don't have any evidence, and we'll have to like circle back to this in another episode when we have
Yeah, you
time
know
to.
what's interesting? Because I'm just thinking about my own kid's situation, and I'm like, what part of that umbilical cord being cut would make it an innie? Because both my kids have innies.
So does Bennett actually. I don't know. I
Yeah.
don't know. That's such a good question.
If anyone has answers,
Any OBs on here,
let us
please,
know. Let us know.
please. We really need to know.
Anyways, as a shout out to this.
I will not be buying this David's belly button buddy lint.
Okay, but local author to Barrie, Ontario. He will be, for anyone who's wondering, he will be at Allendale Rec Center at a book signing on March 9th. I'm not joking.
Oh, I feel bad that I'm like vomiting on a podcast about his book. I'm sure it's great.
No, it's you know what? It could be cute. I think the premise behind it is that it's like you always have a friend if you have poor hygiene.
I don't have that friend. I'd rather be alone.
Anyways, I saw this news article and I just couldn't stop laughing. It says and the author says, I hope they can find something to hold on to that helps them get through any times that they feel nervous. And if it takes a belly button fluff named Bernard to do that, so be it.
I'm so sorry to this
That's
author.
cute.
Maybe I'll take him out for coffee and chat about bathing protocols.
Well, Hugh is the guy's name. What's his first name? Author Leslie Hughes. So,
that's my mom's maiden name. Imagine this is like a lost aunt or something. Oh yeah. Man.
I mean, knowing your family, it sounds like
knowing it probably my family and how weirdly extensive they are.
Yeah.
Yeah.
Well, maybe you can go to the March 9th book signing at Allendale Recreation Center.
Well, now I feel like I have to, really.
Yeah. I feel like you have to buy a book at this point since you slandered this author's name.
And their good intentions.
Literally. They're trying to cure childhood anxiety, Ashley.
Right.
Okay. Moving on. I also saw an article that apparently you can't put your iPhone in rice anymore. Did you know that?
You should have known that. I did know that because that was what I tried to do when my phone was broken like a week ago. Confirmed. This is so true. Won't help shit.
Okay. Ashley, was your phone wet? And you tried to put it in rice?
You know what? Mystery question mark. So I took my phone. I just like the screen was possessed. So I don't know how else. This is what I explained to the Apple people.
I'm sure they loved it.
This phone's possessed. They're like, okay, lady.
Yeah.
But no, like it just random functions would happen. So it would like open up random apps or in particular, when I go to message somebody, the phone would just scroll back in the conversation rapidly. And every time I would try to type, it just wouldn't work. So it was a display issue. So when I dropped it in, they were like, did you drop it in water? And I was like, I don't recall, but like, I've got this dog that leaves puddles everywhere and this kid, but it wasn't like immersed in water.
But if you did get it wet at some point in time, you realize that the idea is not you just randomly put it in rice at any point in time.
I think it has to be pretty soon after.
I think it would have to be immediately after the incident.
I think Ashley's phone problem was an operational issue. And it had probably nothing to do with the hardware.
And I feel like rice would not be the solution.
Right, to this problem. You know what? I just feel strongly that it probably wouldn't work, You know
what? I've done it before. Has it worked? I don't actually remember, to be honest. But it tells you to basically bring it to Apple.
Of course it does. Of course it does. Yeah, so that they can fix it and make money, obviously.
Yeah, so. Anyways, that's the news articles of the day. Let's get into the health topics because I think that's what people are here for. But if you're still here, we're actually talking about one of the few shows that I've gathered that Ashley watches.
Yeah, let's hear it.
Selling Sunset.
Oh yeah, I only watch trash TV, by the way.
But you don't watch Real Housewives?
No, actually. It's just
this is where disconnect.
You know what? I probably just haven't found a place to watch it. Oh no, yeah, Selling Sunset. Like the real estate's incredible and the drama. I'm just there for it,
Mm-hmm. I heard that when I was watching something or listening to something, and I heard that the real estate's actually fake. Like it's not actual real homes are selling.
What do you mean it's not real homes?
So apparently, so somebody on TikTok did some deep diving into these properties and found out that either the home was not listed actually under that realtor,
Oh,
or
but the
it
house
was like,
isn't real. I was gonna say, what was this, a hologram? Like, I don't
oh no no
understand.
no, the house is real, but potentially it's either not their listing or it's actually not for sale, and they just used it for like a good backdrop.
Oh, okay. I'm not surprised by that, actually.
Yeah, it's kind of annoying.
Kind of, yeah, because I do find the houses to be pretty sick.
Yeah.
Um,
So Heather Ray El Musa, she is from Selling Sunset. She is now married to Tarek from HGTV. If you watch, there's an article on Us Weekly, and she's talking about dealing with mom brain 4 months after giving birth. And I wanted to bring this up because symptoms, according to, I'm just going to read the article a little bit, but the symptoms turned out to be an autoimmune disorder. And she said, I remember saying to my assistant, I feel like I'm dead. My brain was so tired. My body was so tired. I was exhausted all of the time, and no amount of sleep could make it better. Um, she, blah, blah, blah. She felt brutal. She could barely get out of bed. And she was 4 months postpartum. Then she goes on to say that her doctor had told her that pregnancy had triggered Hashimoto's disease, and it was depleting her breast milk and kind of causing all of her symptoms. So I wanted to talk a little bit about the mommy brain or something else, and kind of looking at the postpartum picture a little bit deeper.
yeah, absolutely. I think it's important because because there's so many like like the two of us, we mostly work with women, right?
Yeah.
Different ages and stages in life, but a lot of them are moms hoping to be moms, or longtime moms, right? And what we actually know is that really and truly, for anybody listening to this, is like, man, I feel like I'm not firing on all cylinders since having a baby. Facts, actually. Like, your whole body shifts towards the goal of growing a healthy human, right? And being able
Yeah.
to keep them alive in the first couple of months of life. As a result of that, there's actually structural changes found in various parts of the brain. So we know, for example, that the amygdala, prefrontal cortex, cortical thickness of the prefrontal cortex, the hypothalamus increase from soon after birth to 12 to 16 weeks postpartum, right? And
Mhm.
then there's other issues that shrink in the postpartum area, postpartum period, right? So there's like actually structural changes in your brain because, again, from like an evolutionary based perspective, we're trying to keep babies alive, and that's where the majority of your resources are going to go.
Yeah, and we've chatted about this before in some capacity in terms of like postpartum and having all of your nutrients depleted and getting, the proper blood work, but something that we hadn't touched on specifically was Hashimoto's. And I thought that was an interesting kind of twist to that, because mommy brain is such a real thing, but it's like, at what point do we finally realize that like something else could be going on? Because we have all of these changes which are very normal and evolutionary and have their role and their purpose. But then we get to a point where, okay, how long have we been postpartum? Like, should we now be seeking professional advice on this concern? Because and I mentioned previously that I've had patients come see me and they say, I'm diagnosed essentially being a mom.
Yeah. Yeah, and it's tricky because at this time, as you and I both know for sure, as we continue to be reminded when kids get sick and other things come up, is, part of being a new mom too is oftentimes a lack of sleep. And I
Hmm.
also don't think people appreciate how diverse symptoms can be from something as simple as a lack of sleep. So,
Yeah.
yeah, and although that's common, that's normal, we need to still be very diligent as clinicians to take these complaints seriously and dive into it, do the testing if that's within the scope of your practice, to at the very least rule out any of these conditions, because at the end of the day, to me, it makes so much more sense to like rule out any pathology and then be like, okay, this is kind of what we're left with.
Yeah.
um you know no boogeyman in terms of a diagnosis. Now, how do we go on to optimize your health, right? How do we, work on some strategies for sleep, for energy? How do we make sure that we have all the nutrients you need, right? But you can't necessarily work from the reverse end,
Right.
right? You
Right.
can't you can't just throw lifestyle factors at somebody that has Hashimoto's, right? And
Right.
expect that be the be all end all, right?
Right. And most of the time, and like truly, it is multifactorial, and there probably is, low iron and low vitamin D, and also external factors being your kids keeping you up all night or not sleeping through the night. And then also on top of that, potentially like a Hashimoto's diagnosis. Now, I'm throwing around this word, so I just want to kind of go back a bit and just tell everyone kind of what Hashimoto's is, and
Oh, that's a
why
good
we
point.
end up seeing it presenting postpartum, because we see it happen. Now, I have come to believe that there are different areas in a woman's life. So first and foremost, women are more likely to get autoimmune diseases than men. We know that factually.
Yeah.
And so the difference we see is that women actually go through this transitional chaos at certain periods of their life. And now this time happens during puberty, during pregnancy and postpartum. And what people don't realize is that postpartum is actually included in termination and miscarriage, right? We have the exact same process that happens when you give birth to a live baby as when you give birth to, heaven forbid, a stillborn, or when
Yeah.
you have a miscarriage, or when you have a termination, even early on. What
Mhm.
happens is your immune system and your hormones kind of collide, for lack of a better term. Like, we have this crash, and now we are vulnerable to your immune system essentially attacking itself in different ways and forms, right? And so the most common thing we see is actually Hashimoto's. And this is often not picked up in the conventional medical system for a variety of reasons. Some of the reasons I understand, some of them I don't. Number one is the healthcare, specifically where we are. They go off of an algorithm in terms of testing. And so what they're going to do is they're going to say, baseline testing, we're going to do TSH, which is thyroid stimulating hormone. And if there's nothing that comes up with that, they may also run like a free T4. But if there's nothing that comes up with that, presumably they're like, everything's good. We don't need to pass go. And essentially, if something comes up in TSH, we may investigate further. But there's so many nuanced problems in even the testing of TSH and what that even means. And so when I tell patients, TSH is the communication between the brain and the thyroid, and it's having this conversation. Do we need hormones? Do we not? But it does not account for what else is going on underlying. Like, we have to keep in mind that all of our hormones are so intricately connected that one bump in one thing can really cause a waterfall effect with everything else. So, for example, you could have a TSH that's like, let's say, high normal, and we're like, ooh, might have a thyroid issue. We test the rest of the thyroid panel. We're like, oh, everything's actually really good. In fact, everything's really great. And so that would actually lead me to consider that, oh, something else is pulling on the TSH, for example, right?
Right.
Something, and I put it in quotations because we're not physically pulling on it, but this is just for,
Mhm.
a better simplification here. But essentially things like stress hormone, things like progesterone deficiency, right? A lot of these other things, prolactin levels. We
Yeah.
can't look at just the thyroid in isolation. And so there's that piece of the puzzle. And then there's the piece of the puzzle where it is conflicting in the research as to like what's optimal. Like, we have fertility clinics that say your TSH has to be between 1 and 2.5, but or some even say between 1 and 2, but as soon as you give birth, it's like, oh, yeah, no, your TSH can go up to 4 or 5 and sometimes even 6 before we're even going to talk about medicating. And so it's like, okay, what is a
And you have to
normal
think to yourself,
TSH?
yeah, like if it's ideal for conception
Yeah,
and, health that way, why would we change those cutoff values for day-to-day life? Like, is if
right.
that's ideal.
Right. And that's always my question. It's like, why are we looking at, so you, same person, Ashley, your TSH should be between here and here for you to conceive. But as soon as you're outside of conceiving, yeah, it can be whatever.
We
We're
could just go
good with
rogue.
whatever.
Yeah, that seems crazy to
So
me.
that's the first thing that's weird to me, because that means that either at some points of your life you're going to have investigations and other points you're not. The other thing is, we know that having thyroid antibodies is actually an independent predictor for miscarriage risk. So
Yeah.
we see this specifically if we see this in a primary pregnancy and this happens afterwards, my conversation with the patient is, do you want to have more kids? Because
Mhm.
getting a full thyroid eval is important because we know that antibodies are an independent predictor for miscarriage. So in the fertility clinic, I'll be very honest, I worked in a conventional medical fertility clinic, many of you know, and I actually work with a lot of patients that work at fertility clinics elsewhere. And what I found is the fertility clinic I worked at was the only clinic that routinely ran thyroid antibodies. And it is specifically because they have naturopathic doctors that work in their clinic. And we essentially can, essentially do something about antibodies when, Synthroid, the typical medication, doesn't do anything. So that's really kind of like the short answer on that. But I find that most people aren't getting screened. So essentially what happens during Hashimoto's is I mean, it kind of is a coin toss, but let's just picture it. Let's paint a picture. So you're classically in one of those transitional periods. So like I said, it's going to be like puberty, postpartum, whatever that looks like, as well as usually perimenopause, menopause. This is why now you're into the phase, you're like, and now everything's a mess, right? If it didn't happen after kids, or maybe it did, and then you're just sort of noticing everything else hits the fan around perimenopause. But essentially what happens in Hashimoto's is really there's antibodies that are created. So your immune system is acting against your thyroid. And the first thing that happens ultimately is your immune system attacks your thyroid gets inflamed, and the first thing it does is it dumps out all its hormones. During that dump, we actually might be asymptomatic, and we actually, if we're going to have symptoms, might have anxiety, might have heart palpitations, might be sweating, might feel like we have greasy hair, we're like having loose stool, our nervous system is kind of keyed up. And what does that align with? Postpartum anxiety.
Right. Mental health
So,
is well.
Mom has a baby. She's like, let's say it's a thyroid dump. She's like, doctor, I'm anxious. So I see a lot of this. And then I see also similar thought pattern is in perimenopause. Patient sees me, they're like, I have heart palpitations. I've told my doctor we haven't looked into anything. Well, that is also a symptom of a thyroid issue as well. We don't have to have a TSH that's like thrown off the handle in order to have these symptoms, right? So I think the biggest thing is we just don't get evaluated. And then what happens is, again, the research says 50% of the time this dump makes your thyroid go back to normal. 50% of the time you end up in an underactive thyroid, like coin flip.
Well, I think we should also look at duration of symptoms as well, right? Like, and contextually. So if you have somebody saying like most people, I'm going to go out on a limb and say most people have battled or have had, some situational anxiety related problems in their life, right? Where maybe they're dealing with more stressful situations and they know what it's like to live with higher levels of anxiety.
Mm-hmm.
So if there's, when you're talking to an individual and, they're having these heart palpitations, sweaty, clammy, whatever the symptoms are, and you talk to them and be like, hey, is there anything different going on in your life? Like any new situations? Like what are your stress levels like? And if they're like, you know what, none of this actually matches up. Overall, things are going well. Like I feel like in the situation of being a postpartum mother, I feel well supported. I don't have stresses of work right now. I'm off on mat leave and, we're good about that. I've got good community support around me. Like I'm really not overly anxious due to any other situations too, right?
Mm-hmm.
So I think we want to look at that in context and how long it's going on for, right? So if there's no kind of known mechanism and it keeps going on, like that alone, I think should be some reasons for some further investigations, I would think.
Yeah. And I think also the problem is a lot of times it's not alone, right? Like a lot of times it is like, I'm overwhelmed. I have 2 kids. I have 3 kids. I
Yeah.
have a newborn, whatever.
Too.
Right. So we're not necessarily able to pick it apart from kind of the
Right.
rest of it. But I think, I think it's not investigated. And I think there's not enough importance put into the fact that someone could have a normal, otherwise thyroid markers and have antibodies and that be a problem. Right.
Mhm.
So I think, we have to like really broaden the way we think about and treat this. And one of the biggest things is in conventional medicine, we actually don't have anything that treats Hashimoto's specifically. We have Synthroid, which helps with your TSH, but it's shown that it actually doesn't do anything for antibodies. so there are specifically researched things, but just like anything else, we need to be looking at the whole picture. We know that Hashimoto's is associated with certain microbiome perturbances. We know it's associated with certain cortisol manifestations. We know circadian rhythm plays a role. Excuse me. We have research things like selenium and inositol, but like going out and buying like the thyroid complex supplement is just not the move, right? Because
Right.
it's like any other autoimmune disease, it's very layered. And so I just wanted to bring it to light, because if you are somebody who's feeling like you have mommy brain or perimenopause brain,
Mhm.
time to make sure you've had a full panel done.
Yep, exactly. Have it investigated, and if that's truly, just your brain and where it's at, that's one thing, but if it's not, then you deserve to have the help you need.
Totally. I found this study talking about, and I actually didn't really look into it myself, nor do I have many thoughts, but because Dr. Ashley specializes in like exercise and women in exercise, I thought this was interesting. So, the study's called Women Get the Same Exercise Benefit as Men, but with Less Effort. And the summary says a new study shows that there is a gender gap between women and men when it comes to exercise. The findings show that women women can exercise less often than men, yet receive greater cardiovascular gains.
That's so interesting to me. And again, if I'm going to be perfectly honest, I didn't dive into a lot of the research surrounding this either. Um, I just find one of the things I did kind of note, and I think is interesting. So in my time in clinical practice and my time training in the gym, what I find to be, I do find that there's some male and female differences, if you will.
Yeah.
Now, whether that reflects in these health findings, that's another thing. But I am finding that women, or most of the women that I work with anyways, are becoming far more intentional about the gym. Like
Mhm.
they go there and it's like a focused workout. They know what they're doing. They have a short amount of time in which to achieve those things. And it's very much like, this is my gym time. I'm focusing on this, do as much as I can in that time. Versus most men that I have the opportunity of working with, will often, when I'm asking them about their physical activity and what they do on the day to day, they'll kind of, most of them be like, well, I'm like active for work. I'll be like,
Yeah.
okay, like I don't doubt that. I'm not discounting that, but like, what is your intentional movement look like during the day? And again, a lot of the men will be like, well, I walk around a job site.
Yeah.
or or what they'll say is they'll play like a beer sport once a week. They'll be like, well, I play hockey on Monday nights. And I'll be like, okay. And like, how long do you play for? What does that look like? Like, what's the caliper of play, right?
Yeah.
And then, I end up finding out, well, we basically scoot around the ice for an hour, and then we, pound two beers afterwards. And it's kind
Yeah.
of like, so I wonder if that's a part of it as well. Again, I have no scientific proof, don't hold a
Well,
gun to my head, but I think there's getting to be more differences I'm noticing with intentions in the gym.
yeah, and I think regardless of the study outcome, I think that's an interesting point. I also think
Mhm.
it's good to bring up the idea that your activities that you do every single day at your job put you at baseline zero. And the exercise that you have to do has to be up from there. So if you're the person that sits all day at a desk, sure, maybe you can, mix in some walking a couple days a week to start. But if you're the person that's, working at a job site, that's not going to be considered intentional exercise, and you're not going to have the same benefits.
Well, because in your body, the cool thing about the body is that it really does a very good job at adapting to the loads we put it under. So for the individual that easily gets 10,000 steps a day working on the job site, we need to do more to, raise your heart rate and to get your muscles working harder above your baseline, right? In order
Mhm.
to see those, positive metabolic body composition changes, right? Because your body's going to be quite used to that. Um, so yeah, I would agree with that actually.
Yeah, and it's even and it's the same thing. Like you said, when you go to the gym, you need to always keep leveling up. You lift more. When you stop
Right.
lifting, you now have to go back to a lighter weight because your body's not used to that. So I think we have to talk about, adapting to, it's like, oh, I move at my job. Okay, well, now you got to move more.
Now we gotta move more. Yes, exactly. We got to push the needle a little bit.
The conclusion they have that I thought was interesting is that women get the same benefit of doing 140 minutes per week of physical activity, vigorous, moderate to vigorous, that men have to do 300 minutes. So I
Oh,
think
so
that's
that's for
actually,
them.
I think that's like a really encouraging
It
outcome.
is very encouraging, and yeah, and creating those starting points too, right? It's not that
Yeah.
you're necessarily going to jump from 0 to 140 minutes, but it's nice to know that it doesn't take a ton to derive some significant health benefits.
Yeah, totally. Last topic for today is scientists discover a new target for reversible, non-hormonal male birth control. Now, before you
Mhm.
comment, I'm going to tell you how it works. Essentially, the drug is an ADAC inhibitor. It blocks sperm production and fertility in male mice without affecting libido or future reproduction? Question mark?
Question mark?
Question mark.
Tough thing to say when you don't have the long-term data, right?
I know.
Funny. So I looked at this and I was like, I already know, like, I feel like I know what the male population is going to think about this, but I'm like, we're going to ask one.
Yep. Yep.
So, I pulled N1, my boyfriend, and was
Yeah.
like, would you take male birth control? And
Yeah.
I told him what it was and whatever. And he was like, you could tell because he was like, why are you asking? I was like, it doesn't matter. It's
Yeah.
not your opinion. And he started out quite diplomatically. But at the crux of it, he kind of said the same thing, right? Like, well, there's really no long-term data. And, in general, I'm not comfortable with those, interventions that we don't have some basis of comparison, right?
Mm-hmm.
But then as we like broke it down or whatever, it was also very much like just a general apprehension of like, we're not messing around with that.
Yeah.
Right.
Yeah.
And admittedly, he had also said, there's a big, kind of the cultural paradigm, whether we like it or not, is birth control. A lot when you say the words birth control, I think a lot of people automatically think oral birth control in terms of hormones, right?
Yeah. Yeah.
And they think of the pill, if you will.
Yeah.
And he's like, for so long, at least in his generation, that's kind of been like up to the woman, if you will, right?
Yeah.
So I think also you're gonna see that it's gonna take a longer time just to shift
The
that
culture.
cultural norm, the thoughts around birth control, whether it is, effective or not.
Yeah. And I even look like I'm obviously looking at a very specific lens when I look at stuff like this because I know that the role of the birth control pill is to disrupt the communication between the brain and the ovaries, essentially. And then you go off and allegedly things are resumed. But I clinically see a lot of problems. And so this says, excuse me, within 60 days of going off the pill in this circumstance, the animal's fertility was completely restored and all subsequent offspring were developmentally healthy. I was just trying to find how long they were even on it for because when you
Mhm.
go on the birth control pill, like really it's a non-issue as well if you're on it very short term. It's when you're on it longer term that any sort of, side effects or communication between the brain and ovaries gets lazy essentially happens,
Right.
right? So I don't know the answer. I agree. I think it's a culture shift. I think it's a conversation. I think we're not ready for it as a society.
No, no. Or what we need to shift our expectations in knowing that we're going to have to take a little bit more time educating couples in the male population and just expect a little bit of pushback there and just kind of work with it, right?
Yeah. Yep. No, I completely agree. Closing remarks.
I don't think so. Not today.
Today
We
was
covered a wide variety of topics today. It's like podcast whiplash.
Yeah. So
I
hopefully,
love it.
a little bit of something for everyone. Again, if you have questions, please send us an email, find us on social, like, all the
We're
things.
super happy to talk further about these things.
Yeah. And if you have any topic suggestions, please feel free to submit, because we're always open to chatting about whatever you are interested in learning.
Absolutely.
Follow us on Instagram. We have the Health and Her Pod. Is it Health and Her Podcast? Oh my God, do I not even know our Instagram handle?
Awkward. We should get this right. Pull it up on
Okay.
Instagram.
Anyways, I'm Dr. Laura ND personally.
I'm Dr. Ashley Barker, DC.
Yeah,
So
it's Health and Her Pod. My confidence
good.
level dropped.
Whew.
My
We
confidence
know what
dropped.
our podcast is.
Yeah.
Follow us.
Instagram's at Health and
We
Her Pod.
promise we're smarter than we sound sometimes.
Yeah. You can subscribe to YouTube, subscribe anywhere you listen to your podcasts, so you'll get notified of new episodes, and we'll see you later.
Soon. Okay.